Hi everyone, in this lecture I'll be going over goal development, why to create goals, and how to do them in therapy specifically. And we'll start with discussing why create goals in the first place. Well, first off, not having a goal or a clear enough goal will often lead to failure and can create feelings that will impact self-esteem, motivation levels, and success, right? So when you make a broad goal, like a New Year's resolution that's not very specific, it is more likely to fail and then make you feel bad about yourself, right? Goals are also helpful for figuring out specific outcomes, like what exactly is it that you want? What is the minimum score that you want on that test? Or what exactly do you want your social relationships to look like after therapy, for example? That's really helpful for developing a realistic goal. In therapy, establishing a rationale and a goal-oriented framework in the first few sessions is going to capitalize on the importance of perceived treatment credibility, as well as the facilitation of task and positive treatment outcome expectations. Research does highlight the importance of promoting clients' early positive treatment outcome expectations, meaning their goals and the belief that they're going to achieve those goals, and their perceptions of treatment credibility. And like I said, a big piece of treatment credibility is seeing that you, the therapist, are helping them to establish a clear and specific goal and strategies for achieving that goal, right? Another issue here, therapeutically about creating goals is it's going to motivate and challenge the client. If you don't care about the goal, or it's unclear, or you don't know how you're going to meet it, or it doesn't seem like you're going to reach it, you're unlikely to work on it. And therapy is only going to go so far without really clearly defined goals. Now, according to our ethical codes and the law, goals are also important here. First off, the ethical code of autonomy, right? We want the client to be able to take ownership of the therapy session and to feel like they are working on what they want to work on. And that is a big part of that is goals, right? So we want to make sure that we are collaborating in the development of goals with our clients. This means that you're not coming into the session saying, okay, you're sad, so your goal is to be less sad. Maybe, but is that what they want to work on? Or are they here to work on something else? Like maybe they want to increase their, I don't know, social interactions or increase their work performance. I don't know. Whatever it is, it needs to be a collaborative goal that the client feels they have played a part in developing, and it's going to increase their motivation to then work on it if they can take ownership over that, right? So what are some common goals in therapy? And this is from positive psychology. Facilitating behavioral change, definitely. We see goals like reduce impulsive behaviors with children, right? Helping to improve a client's ability to establish and maintain relationships, whether that be setting boundaries, improving their self-esteem, learning to interact, not isolating as much, whatever those things may be. Helping enhance the client's effectiveness and ability to cope. So goals related to learning relaxation skills or adaptive coping skills, definitely common. Helping to promote the decision-making process and facilitating client development. Sorry, that should say client potential development. So here, learning how to assess and evaluate a problem, developing a problem-solving steps or procedure, learning how to evaluate pros and cons of things. And addressing things that are hindering development. Absolutely. Now, remember that the goals do need to be things you can work on in therapy and bill for as a clinician. And so a goal like, I don't know, make $1 million, well, it's probably not something you can work on in therapy. I guess you could work on some motivation stuff, I don't know, but it doesn't need to be a therapeutic goal, a mental health related goal, okay, in therapy. Okay, how do you identify goals with your client? The miracle question can be helpful. And this is, if you were to wake up tomorrow and everything was better or everything was fixed, how would you know it? What would be different? And whatever they identify can be a useful starting point for developing a goal. There are some other questions that might be helpful to consider listed here. What do you want to get out of the counseling process? What do you believe is inhibiting you from achieving your goals? What are your expectations for therapy, your motivations for making change? What is the minimum you'd be satisfied with in therapy? So these are all helpful questions that may start to gauge where the client's at, where they're trying to go, and can influence the development of your goals. Now, how do you go about actually writing the goals? Well, in general, goals should be written in clear, concise language and be easily understood by the reader or the client, right? This is not the place for really complicated words, right? So you wouldn't write something like client will reduce internalizing behaviors if the client doesn't know what the heck an internalizing behavior is, right? So describe it in words, whenever possible, in their words. What do they describe the things that how do they describe the things that they're wanting to address? The number of goals in therapy will depend on a number of factors, including the client's ability, the length of the time that you're going to be working together, circumstances in the client's life, and so on. But in general, we're looking at about 2, 3 max goals. Okay. And another thing to keep in mind is the framing. So you want to try your best whenever possible to use positive framing instead of negative. And I don't know if I have, I don't, but I might have a slide. And what that means is instead of talking about what the client is going to stop doing, talking about what the client is going to be doing, right? Although problems can provide an excellent starting point for goal reduction, or sorry, for goal creation, we want to try to turn something negative into something positive, meaning a goal, in order to move toward recovery and strengths-based orientation. So positive framing is going to help to improve or a sense of accomplishment in therapy and clarify indicators of progress. So rather than saying something like decrease feelings of depression, okay, well, how are they going to do that? You could say something like increase adaptive coping, right? And so then they know if I increase, then I'm meeting the goal. And it's very clear how they're going to go about doing that. And we'll get to SMART format in a little bit to make it specifically clear. But when you say something like decrease feelings of depression from 5 times a day to 0 times a day, well, how are they going to decrease that depression? How do they know that they're working toward that goal, right? Is it just if I wake up and I feel less sad, I've met the goal? Well, no, right? There's more to it. So writing it in positive framed language whenever possible is helpful. Sometimes not possible. Okay, so when you, if you're working at a DMH contracted site, you're going to use a client treatment plan. And the first part of the client treatment plan is going to have the long-term goals on it. And your client's long-term goal is basically their hopes and dreams for the future. Okay, what are their motivating forces? What exactly do they hope for themselves in the long term? And you're going to want to use a direct quote from the client. Okay. Now, what's distinct about long-term goals compared to short-term goals is that they don't have to be specifically related to therapy with you, right? If their long-term goal is to get married and that is their goal, then that's what you write there, to get married. If their long-term goal is to live a happy, successful life, you write that there. Now, is that something that you're going to be able to write in as a goal in therapy? Probably not. But it's their long-term goal. So it doesn't matter if it's specifically related to what they're going to do with you. Now, the short-term goals absolutely are related to what they're going to do to you. And a great way to start here is to return to the functional impairments and symptom descriptions that you have identified in like your assessment, right? What did they describe that they were dealing with or struggling with, and what areas of their lives was it affecting? Whatever's causing the most impairment should be targeted first in your short-term goal, meaning it should be prioritized. And if necessary, you're going to break it down into smaller steps. Now, your short-term goals should be written in SMART format, meaning they're specific, measurable, agreed upon, realistic, and time-based. I think I thought I had another slide here. So let me break these down a little bit for you. So with specific, we want it to be specific to this client and their specific problems, symptoms, goals. This helps to focus their energies on a specific thing, right? And it shows sensitivity to the fact that not everyone's mental health issues manifest the same way. So a person who is depressed doesn't necessarily have every single symptom of depression that's in the DSM. Right? And they might not even have your predominant symptoms of depression. So you want to make sure to make it specific by describing what they in particular are dealing with in terms of symptoms. With measurability, if we don't have a measurable goal, how will you know that you achieved it, right? And so having a measurable goal is going to help to gauge your efforts and to let you know whether or not you're working hard enough. And it's going to allow you to monitor progress. So we always want to provide numbers for measuring. So we can say, for example, increased use of coping skills from 0 times a day to 2 times a day. And that 0 to 2 has made it measurable. You could also use percentages if you like. If you wanted to go with like the decreased depression goal, which is a common one, you could say decreased feelings of depression and describe what those are from 40% of the day to 30% of the day, something like that, okay? With attainability, we want to help to avoid unattainable or unrealistic goals. The goals should be achievable in the given time frame that they have of therapy. So if you have 12 sessions together, right, it needs to be something they can achieve in those 12 sessions. It should also be something that the client is willing and believes that they are they are able to achieve, right? So for you, increasing coping skills to 2 times a day may feel attainable, but does it feel attainable to the client? And are they willing to devote the necessary time and resources to attaining that goal? And if not, then maybe you need to leave it at 1 time per day. Right? Realistic and relevant is the R. The goal needs to be in line with reality. What kinds of actions have been taken to support the goal in the past? If you're struggling with the goal, you might need to adjust it to make it more realistic. Okay, if they've tried it before and maybe not met the goal, how can you adjust it so that it is more realistic for them? And then finally, time-based. You want to establish a clear amount of time that you're going to dedicate to the goals and when you're going to reevaluate the goal so that there's an endpoint essentially. And you can at that endpoint decide, okay, have we met the goal? If yes, okay, what are we going to work on now? If no, how can we adjust it so that we can meet it next time, right? Or the next round of therapy. So this chart here from Therapy Connect gives you a little example of SMART versus non-SMART goals. And you can see just by looking at the length that your non-SMART goals are going to be a lot shorter and a lot more vague, or they're not related to therapy at all. And so the SMART goals are going to be much more descriptive, and they're going to have more of the components that you need. Now, I will say that these here still could be improved quite a bit. Like, for example, the first one, make 10 requests for items using visual support in a therapy session by 1 to 13 is great. The only thing that I would say to add to it is a starting point. So if the goal is to make 10 requests, are we assuming that they're starting at 0? Like they never do that right now. So that would help with measurability. Complete 3 turns in a peer conversation during a social group session. Again, where is it starting from? I might also make this a bit more broad because once they do this, then do you add in a new goal? Maybe. And so you can kind of go through them and critique them yourselves or see how you might be able to improve them. But these are just some examples for you. A helpful template. So if you're struggling with coming up with a goal or knowing how to word it, this might be helpful for you. So I will, and then your goal here, by, how are you going to do it? I'll know I'm making progress because, how are you going to measure it? For, the time goes there. And so you could say, I will increase my use of coping skills by practicing deep breathing and mindful meditation. I will know I'm making progress because I will use those skills 5 times a week, up from 0 times a week, by the end of my 3 months with my therapist, something like that. You could then take that and tweak it to make it more therapy goal worded, but you have all of the components there. Right? Okay, so I have some examples of some SMART objectives that do have all of the components that are necessary, and they are more therapy minded. So decreased level of anxiety by increasing calming statements. I am calm, I'm in control, from 0 times a day to 1 time per day. Increase socialization by participating in 2 community-based activities per month from 0. This one, as I'm reading it, I notice is missing an endpoint, so add an endpoint there. Oh, I think the first one is too. That might be a deficit on my part here. They're missing endpoints. Decrease anxiety in social situations, give examples from a level 8 anxiety to a level 4 anxiety. Decrease panic attacks from 7 times a week to 4 times a week. So these have everything that they need with the exception of that endpoint. So make sure to add in that endpoint if you're going to use these or modify these for yourselves. What not to write. So these are some examples of some poor goals. Providing linkage and community resources is a nice goal, but it's not a therapy goal. It's like a case management goal. So that wouldn't work. Will consistently meet with psychiatrists and comply with taking medications is a great goal for the psychiatrist, but you're not a psychiatrist, and that's not something that you are going to address in therapy, so that wouldn't work. Client will maintain medication compliance, same thing, probably a goal for the psychiatrist, not for the therapist. This gets us a bit outside, well, not a bit, a lot outside of our scope of practice and can be problematic legally with something like that. Client will request linkage to community services. This is great for the client to do, but it's not a therapy goal, right? You could modify this into a therapy goal. If you said something like client will increase advocacy for self, and then this might be an example of that, because then in therapy, you can work with them on increasing that advocacy. Whereas this, I mean, what are you going to do in therapy? Ask them, did you call your health insurance company? Like that's it. Like there's not much you can do with a goal like this. So doing something like increasing advocacy is a little bit better. Client will reduce symptoms. We don't know what those are. So what are the symptoms? Client will reduce severity of symptoms. Again, we don't know what the symptoms are. We don't know what the severity was to begin with. So not very helpful. Okay, crisis-related goals. So if you have a client who is experiencing suicidal or homicidal ideation or self-injurious behaviors, your goals always need to move to extinguish, meaning they should not be like, client will reduce suicidal ideation from 2 times a day to 1 time a day. That endpoint always needs to be 0. So client will reduce suicidal ideation from 5 times a day to 0 times a day. We always want to move to extinguish because no level of suicidal or homicidal ideation is okay, right? We always want to bring that to 0 because we don't want our clients to kill themselves or anyone else. You should also always make the suicide and homicide goals separate. Don't mix them into like your broader depression goal. It should always be its own separate goal. Now for self-injurious behaviors, those don't need to move to extinguish necessarily. It depends on the severity of the self-injurious behaviors. And a good approach for these is to work on increasing the replacement behavior, right? What are you replacing the self-injurious behavior with? Is it journaling? Is it, I don't know, a sport or whatever it is, and having them increase that to address the behavior would be helpful. Okay, so now there are some barriers sometimes that you may encounter with goal development. Research does show that those who are depressed have more difficulty setting goals, for example, and are less likely to believe that they're going to achieve their goals. Okay, they have those feelings of worthlessness, for example, that are going to really come into play here. They also tend to use more avoidance goals as opposed to approach goals. Avoidance goals are those that strive to reduce the negative outcomes, like the decreased depression, versus approach goals are those positively framed ones, like increasing self-care or something like that. And so when you're trying to help them to feel successful and to put them on a path towards success, having more of those approach or those positive worded goals can be helpful with depression. But if you are encountering difficulty with them coming up with a goal, know that that's normal, and know that you may need to provide a bit more support with them in goal development. Now, if your client is struggling with coming up with a goal, the emulation activity might be helpful. This involves imagining that you are someone you respect or you admire and writing down all of the qualities of that person that you admire in each area of their life. So school, finance, family, personal relationships, health, etc. And then once you've written that out, talking through or exploring what it would take for you yourself to get closer to becoming like this person that you admire in your own life. You can also work on breaking things down further by looking at each domain of life and trying to identify ideal visions of life in school or in work or in social relationships. And that may feel less intimidating or less daunting than coming up with a broad goal. Okay. So what I would encourage you to do is to practice trying to write a goal for each of these issues that you are very likely to encounter in therapy as a clinician, and try to write them in SMART format as best as you can. And then when we come back to class together, we can look at those and tweak them and give you a template in a sense that you can use for when you're writing goals in your own practice. Okay. All right. Well, thank you for listening. Let me know if you have questions.